society, there is a shortage of knowledge when it comes to safe-sex practices. While it may be somewhat talked about in classes at school or certain presentations for heterosexual partners, there is definitely a lack of education on the subject for same-sex couples. Research conducted in 2010 has found that young gay and bisexual men, aged 13 to 24 years, made up 72% of new HIV infection diagnoses. It was also found that 30% of new infections were among all gay and bisexual men. In a study that was presented on March 4, 2014, at the Conference on Retroviruses and Opportunistic Infections, it was found that an HIV-positive person using antiretroviral therapy was at least 96% less likely to spread HIV to their HIV-negative partner. These statistics show that much more needs to be done in order to educate the GLBT community on how to perform safer sex practices in order to reduce these viruses from spreading. Our program will strive to decrease these rates by implementing an effective program that will aim on closing the performance gap. In order to achieve our goal, we will be educating the leaders of the Texas A&M GLBT Resource Center by teaching them how to increase the awareness, sensitivity, and knowledge about the GLBT community. Our program will also stress the importance of advocating safe sex practices as well as the potential dangers that the GLBT community could be exposed to. The program will also strive to increase personal awareness of one's sexuality, sexual orientation, and sexual identity. Some people might find a stigma attached to the GLBT community, which could make it more difficult to educate on safe sex practices, as well as religious views that advocate against the GLBT community. However, the statistics on rate of infection show that there is a definite demand for educating the GLBT community on safe-sex practices. Should I redo that one? Some of the objectives that we hope to achieve are that youth leaders will be able to describe terms associated with the GLBT community, including sex, gender, sexual identity, and sexual orientation. Youth leaders will be able to demonstrate 4 different ways in which they would communicate with members of the GLBT community that makes them feel comfortable. Youth leaders will also be able to differentiate between gender, sex, and sexual identity based on terminology on a post-test, and will then be able to use their knowledge to educate the GLBT community. Youth leaders will then be able to list and explain 5 reasons to practice safe sex. And finally, youth leaders will be able to list 5 methods of practicing safe sex with a partner. Our program will hold a 3-hour session on Saturday. We plan to help the leaders achieve all of the objectives by making them participate in various activities and lectures that reinforce their knowledge on the matter. We will be holding activities such as icebreakers, skits, and a hands-on condom demonstration. These activities are designed to encourage the GLBT leaders at Texas A&M to participate in this program and work towards closing the performance gap. In this case, we are trying to eliminate the conservative stigma that Texas A&M holds towards the GLBT community. We hope to see you there, and a little reminder, we will be providing free food to all attendees. Thanks and gig 'em!